All right, hello and welcome to our Willmar Area Women's Fund to all of our donors and guests. I'm Hallie Johnson, Vice Chair of the Willmar Area Women's Fund, and later you'll hear from Jean Gasilius, our past chair. On behalf of the Women's Fund, we wanted to sincerely say thank you for your support in helping us stand up and say, not here, not our kids. Together, you have continued to help us make a difference in the lives of women and girls facing sexual exploitation and families impacted by trauma. With your donations, we were able to reach our goal of $50,000 with a grand total of $57,240 across 127 different donors. Because of these dollars, we were able to grant out almost $40,000 back into our community in an effort to fund and fuel our partners' work to stop sexual exploitation, assist victims and prevent the occurrence of exploitation, and bring trauma-informed care training to Candy, Ohio County. We are happy to share that the following grants have been made this year to these following organizations. $2,000 to Greater Minnesota Shelter Care for trauma-informed care training to support our youth. $5,000 to Candy, Ohio County Health and Human Services for trust-based relational support training. $5,000 to Pack for Families Collaborative for trust-based relational intervention support training. $5,000 to Project Turnabout trauma-informed care training lunch and learns. And $20,000 to Safe Avenues for community outreach and awareness efforts for the prevention of sexual exploitation. While we're disappointed that we're not able to come together in person to share our appreciation and provide update from our grantees, we thought we'd like to take the time to bring you a personal update virtually. During the next few months, the Willmar Area Women's Fund plans to do a multi-series of webinars to update our donors on the work you are helping to fund. We look forward to continuing to share with you so that you can personally listen to our grantees share the impact you are making here in our community. Again, we express our sincerest gratitude for your continuing support of the Women's Fund. First in our series, we'd like to welcome Rochelle Peterson from Pack for Families Collaborative. In the past 2 years, the Women's Fund has granted $10,000 to support the work around trauma-informed care training to Pack for Families Collaborative. We are excited to hear from Rochelle and the work they are doing in our community. Please welcome Rochelle.
Welcome, Rochelle. My name is Jean Gasilius, and I'm the past chair of the Willmar Area Women's Fund. I've been involved with the community since about 2018. And Rochelle, we have just 6 questions that we're going to go through and ask you to hear a little bit more about your organization. So the first question is, can you tell us a little bit about your organization?
Well, Pact for Families is a children's mental health and family services collaborative. So collaboratives were created by the legislature in 1993, where basically you bring communities together, and with a joint powers agreement, we have a 5-county collaborative now, but with different partners and agencies. We have 16 school districts within our 5 counties. About 40 member agencies, private and public, youth serving, and mental health agencies across our region that are partners with us. So basically, we come together to try to find gaps in services and the needs in the community and try to bring people together to fill the gaps.
That's great. Thank you so much. Now, can you tell us a little bit about the training that you completed that the Willmar Area Women's Fund supported?
So do you want me to talk about the last 2 years, as you kind of said? So through COVID, and it's been kind of a rocky ride trying to get things accomplished, but initially back in February of 2020, before COVID really hit our region hard, we were able to hold 2 full days of training for foster parents, adoptive parents, grandparents. Some professionals attended. We had school teachers, we had school social workers, some community members, agency workers that attended. So there was the same training, but 2 days, and we had to do 2 days because we had about 250 people attend, about 120, give or take, each offering. So And the feedback was so tremendous that it was the best training they'd ever attended. We had some group home workers and such, and I had a guy come and tell me that he's been in the field for 20 years, hates to go to training, almost more than anything. And he was asked to come, and he said it was the best training he had ever been to in his entire career. And people just asked for more and more and more. And I think with TBRI, I think it's so basic that anybody can wrap their head around it. And it's actual, it's not just trauma informed, it's taking it to that next level of how do you actually take these things and utilize them in your own home and in your own experiences. And it's very, very easy to wrap your head around it and to implement it. And I think that's what people have really connected with. They don't have to keep going to more and more and more trainings to actually take some of these things and implement them in their own home. And even as the trainer, her name is Megan Galbari, says, you know, you can use this with your own children, even if they haven't come from trauma or hard places. I mean, these are really basic things that just help with trust and relationships with people. So we did that in February of 2020. And then it was so nice to receive more funds during COVID. And that's where it got a little more sticky is, so we partnered with Candida County Family Services to do kind of a two-pronged approach. And that was to train teachers and people that were working with young people in the community and bring that. And we ended up having to do that virtually, which is never, I don't think is perceived as well or received as well in attendance. People don't necessarily want to attend an all-day virtual training. So we did that last August, so a year ago, August, and we had about 38 people attend, and that was, we did a two-pronged 2-day, and then we came back in December to help. So those 38 folks who attended, mainly school folks, and then they were able to come back and we did a half-day follow-up in December, and did that on a Saturday. Actually, we did a survey for everybody who attended and said what works best, you know, kind of a half a day at the end of the day, a Saturday, an evening, and hands down the folks just said, how about a Saturday morning, and we'll do it right away Saturday morning, kind of gets it done. And I think because we're seeing a lot of people doing virtually all day during the week, they just couldn't, you're not going to add another evening component. So that was really well received. And I think even though we had small numbers, I think it was very tangible, and people who attended really wanted more tools in their toolbox. And that's, I think, what you see is people just saying, I need more tools. I need more things to actually utilize day to day with the kids that I'm working with. So that was that part. And then I just, because in part of what we did with Candida County Family Services, I'll just touch on that. We had a combined effort because we were able to provide the 4-day training, which we wanted to do last fall, but the trainer really wanted to do those 4 days in person. And we held off. We thought maybe we could do it in the spring, and the spring just wasn't quite right either. So we kept surveying people who were interested and how do you feel about this? And but we decided to do it in the summer. So we held it at the Holiday Inn, June 30th, July 1st, July 14th, and 15th. And we had 55 therapists. Actually, we had school social workers, we had local therapists, we had school linked providers, and that was mainly it. We had some public health nurses attend, but mainly that was the group that attended. And it was fabulous. In fact, I had pulled out the evals from the last day, and we had a 1 to 5 rating for the training. And I would say 95% of them were 5s, and that last 5% were 4s, saying it was, again, the best training they ever had, most realistic, and somebody who had just retired from school social work, who wants still keeping her license. So said, I wish I could have had this at least 10 years ago, working with the kids in the schools. But again, I think the learning that happens and the passion that the trainer has for it, but the easy way it's shared and the examples makes it just really exciting. So I had the questions kind of in front of me, so I will stop talking about those things because I had some more that probably comes in your later questions. So
thank you so much. That's exciting to hear those numbers. Wow, that's great. And the feedback that you received. The next question is, why is trauma-informed care an important gap to be filled in our community? So I'll let you go on and answer that one.
Sure. I think the biggest part that we talk about is, we're living in a community where more and more children and families are coming from trauma. We're seeing it earlier and I think more severe. And I don't think that's an overstatement to say the things we're seeing are more severe and earlier. So we've got kids that haven't even entered school yet who have all of this trauma, and then they enter school and then they bring the trauma into the classroom and it starts, and people are left without the tools and the resources in order to reach those kiddos and their families and work effectively with their families. It reaches everybody. So it's the paraprofessionals in the school, it's the teachers, it's the nurses, it's, the folks who work on the playground, and how we're seeing that in behaviors. And so, and I have that in my little notes. And I think historically, over the years, we work with kids, and I've worked with kids my entire career, from the gamut, mainly teenagers, but you always hear that, this is behavioral, and you always heard that buzzword, this is behavioral. And I think we still hear that, but I think we need to get to the bottom of why the behaviors and what's driving the behaviors. And I think that's what's so important. And so we need to have a level of understanding of trauma and where kids are coming. And we need to be able to approach it in a trust, creating trust and safety. A lot of the kids who come from trauma don't feel safe, and inherently that's what often drives the behavior. It's, even back to that basic fight or flight. And so often what you're seeing is the kids manifesting that fight and flight and that fear behavior. And so we all need to kind of step back, take a look, and try to understand where this is coming from and build those relationships.
Great, thank you. So what impact have you seen on the professionals that are receiving the training? Maybe share a few of those stories, or what are you seeing?
I think what was exciting for me, because Tina and I did the check-in every day for people coming to the training on those 4 days. And, you'd see them come in the second day. And these are all-day trainings, and 4 days of it. And people are saying, oh, I'm so excited to be here. I'm so excited. And you saw people talking about building relationships. And the one thing with the trust-based relational intervention training is it's out of university in Texas. And so a lot of the videos and the clips that are watched during the training are of these day camps that happen for kids from trauma. And they do these day camps, and then the parents come at the end of the day, and then they do some things, reviewing of what the kids learned, some of the things that they're working on in the camp, so that the parents can implement them at home. And what I found exciting is people starting to have conversations. You had 55 people in the community doing similar work, but slightly different, talking about, what we need to do? We need to start having these day camps. We need to start having the day camps here, and having a community-wide effort and figuring out how to do the nuts and bolts that it would take to do those day camps, whether it's, got to find the location, we got to find the certified therapists, and then talking about how we could bring maybe a certified train the trainer kind of a thing here, so that we can build on what we have. So getting somebody certified and finding the funds, so then they can come and do that, because the camps are a little complicated, because it would have to be some billing hours, some clinical hours and such. So, but I saw that, and that was really exciting. People just networking and coming together and talking about their work, wanting to expand it to working more with the families, because a lot of the work that, that we did in those 4 days was talking about working with kids. But we all know that we have to then work with the entire family. So a lot of people talking about what are the next steps and how do we effectively work with parents that have come from trauma who don't necessarily connect the dots between their upbringing and then how they're parenting. And they may want to do better, but just necessarily don't know better. And so those were a couple of the pieces. And then I think overall too, the renewed energy, because in the first couple of days, you could hear by just the tone of the questions of people that are tired, and that they're working with these high need families that they don't know what to do. And so having that renewed energy of like, I have another path. Now I have some more tools that I can go back to my job, and I don't have to take that big, deep breath, but now I have some renewed energy and feelings and compassion. Because TBRI talks about, they don't talk, it's trauma, but they don't call the kids trauma kids. They call them kids from hard places. And so even just that language, it's kids from hard places, kids that come from tough backgrounds and situations, and how do we reach those kids? So I think those things are inspiring to hear, because we all know we get burnt out. I mean, people get burnt out in working, and then especially if you don't know where to go with it, then that's discouraging. But so that's what I see with the professionals. I think a renewed sense of energy and connections and partnerships and next step building.
That's wonderful. Great. Is there any results that you can share, like on the work that's impacting the families and the children that are facing trauma? What results have you seen?
I think as far as the training goes, I even, with back to your first question, what are we doing? We try to find the gaps. I mean, and then try to find the resources and do something innovative. And I think bringing these trainings is part of that, finding the resources, finding the connections. But I've had several people now after the training that we're going to try to get together and make some of these ideas come to fruition. Sometimes they just need a central hub to help. Well, kind of, Sarah, when you were talking about in your meeting when I logged on, is finding that person that can find the key players and make it happen. Where do we find the location? Where do we find the trainers? Where do we find, all the folks coming together? And I think the camps would be a great next step, and it's another piece, because again, what do we do with that, and how do we really impact kids? We talk about one and done trainings, and it's not effective, but how do we long term? So I see that planning starting to happen. Seeing people say, I'm going to get certified so I can do this, because you got to have a few people that are certified for the billing piece of this, for insurance purposes and stuff. And so I see people taking those next steps to actually make that happen, because it could just fall apart and go away. And if we can keep that moving down the road, I think that's probably the biggest thing that I've seen, besides just the fact that I think people are working with families and kids differently. So asking different questions.
Wonderful, thanks. The last question is, any other feedback or missing gaps? You mentioned the one with these camps in this area of work that should be addressed, or maybe you have covered that, but is there any other comments you have? Or
I think COVID barriers are just hard. I think with the school, in fact, some of the feedback forms we got from the 4-day training, a lot of it was because we did have a handful of school, clinical people there. We didn't have teachers and such, but not everybody, but a lot of people said, we have to get this in our schools. We have to get this in our schools. And I think that's hard. And I think last year with COVID, it made it a little more difficult. The timing, whenever you try to find a timing for school folks, it's hard, it's tricky. So I think that barrier is like, we know we want to get it in the hands of everybody in the school, and everybody talks about too. It's not just the school social workers. It's not just the counselors or the therapists in the schools. It is the lunch ladies and the school bus drivers. And I share stories. Sometimes they're at Meeker County Board when I go once a year to talk, and one of their commissioners was retired in his previous profession, but he drives bus part-time. And he said, I know that sometimes I'm the first adult they see in the morning and I might be the last. And he said, I make sure that my interaction with them is positive and brings that child, calmness and hope, and a smile on my face. And I thought, oh, see that? I mean, that right there is what we need to do. And to know that every interaction that a child has the potential to be just a positive one and help bring and build that trust and that hope for that child. And so we know that bringing this to the schools is important. It's just trying to figure out that puzzle and how it can work and making it happen. And that's, that formula hasn't been, I don't think, perfected yet, but I see Jody nodding her head and she knows. And yeah, it's just that's a trick to figure out how to get that in there. So people, and people want to do it. And I think it's word of mouth too. It's people saying, oh, this is the best tools I have now. But so that's my barrier that I think I just want to try to penetrate a little more the schools.
Well, thank you so much, Rochelle, for the update and the information. I love that message that you end with, how to get that trust and hope for those that are impacted. Thank you for sharing the information around your work around trauma-informed care in our community. We appreciate you taking the time to meet with us today. And lastly, I would like to thank all of you, our donors and guests that are on our call today. Without your support to the Willmar Area Women's Fund, none of us, this work would be possible. Thank you for helping us continue to say, not here, not our kids. You can sure follow us on our Facebook page and visit our website at www.notherenotourkids.com for any updates from the Women's Fund. Thank you very much.
Can I also say a thank you so much doing this work and your commitment in taking this trauma message out to our community, because I do think there's so many people, unless you work in it all the time and see it on a daily basis, I don't know if we understand how much it impacts and the ripple effect of our community. So thank you to the fund and to the donors for helping us accomplish a mission so important. So thank you.
Thank you so much.
Thanks.